This interview is made possible by the work of Catholic Charities of the Diocese of Arlington, which is funded in part by the Bishop's Lenten Appeal. We thank all who support this critical appeal and the ministries it funds. You're listening to Searching for More, a podcast of the Diocese of Arlington. On this episode, in 2017, Catholic Charities opened a free medical clinic with just a handful of volunteer doctors. A year later, it has more than 180. See how this clinic is offering a variety of medical services, plus how it plans to expand in the near future. This episode's host is Billy Atwell, Chief Communications Officer for the Diocese.
Alexandra, welcome to the podcast.
Thank you for having me, Billy.
So talk a little bit about yourself. You run this really interesting clinic. We've got this great new ministry in the diocese here, but I want to learn a little bit about the person behind the scenes, the woman behind the curtain. So talk a little bit about where you're from, what your faith life was like growing up, those kinds of things.
Sure. So I was born in Bolivia, which is in South America, came here at a young age after my dad had died. All of my mom's family members were here, so we moved to the States. I grew up in a very devout Catholic family. God has blessed me with an amazing husband and two beautiful children.
Very good.
And I've been a part of All Saints Catholic Church for the last 30 years and have been serving that community for many of those years.
Very good. That's what I think. Either the biggest or one of the biggest parishes in our diocese, and so there is an interesting component there, I think, because All Saints has a large Hispanic population, and within the Mother Mercy Clinic, which we're going to talk about in a second, there is a large. A lot of the folks are Hispanic. They're maybe from the United States or not, but it's people who are poor. They don't have a lot of resources, and it's the only place they can go. Talk a little bit about the Hispanic community at All Saints and how that's maybe kind of contributed to your faith and your social circles.
Yeah, interestingly enough, my mom was probably one of the founders of the Hispanic community back at All Saints. We used to meet in one of the classrooms in the school when we just got here, and it has grown exponentially. We have 3 Spanish masses currently at All Saints, and we have 1 Spanish mass in Manassas Park through St. Gabriel Mission. Right. Which was established by the bishop earlier.
Just recently.
Yes. So it's just been wonderful to see the growth in the community, and believe it or not, their support is tremendous in every way. That community is great in coming to our aid, either to come help clean the clinic or paint or do whatever we need. They're always there, willing to help.
And whenever we're in the communications office, we put something out. Your pastor is always wonderful at reminding me we need a Spanish version of this. So he instigates a lot of the Spanish translations of what we put out. Just I'll forget that he's a great reminder for that. So I'm grateful for it. So we're talking about the clinic. Tell us, what is the clinic? When did it start? Kind of what were the origins of this free medical clinic?
Sure. So actually, Blessed Virgin Mary Foundation bought the building a few years ago from the lady that used to run an abortion clinic. It took a few years to get it to where it is today. They offered the building to Catholic Charities to start a free clinic. And we had to do all the research and find out if the need was really there, et cetera, get certain approvals. And in December of 2017, we were finally able to get the clinic opened after we had the blessing on the 19th of November by the bishop.
Yeah, I remember speaking with one of the folks from the Blessed Virgin Mary Foundation at that dedication, that blessing, and he said, we didn't want to just end a bad, we wanted to start a good. And I thought that was such a beautiful foundation to build this medical clinic, is they wanted to end, the abortion clinic that was there. There've been people praying outside of that clinic for a long time, praying for an end to the abortions there and to the end to that clinic, and then to convert it into a clinic of sacred purpose, as ministry, was very inspiring. It was a very unique event to be at, because when a ministry gets launched, it's a beautiful thing. But the transformation of what it was to what it is was really inspiring. I'm sure you felt the same.
Oh, definitely. I walked into the clinic before it was completely transformed. And it is completely different. And I think, and probably most of the patients and volunteers can attest to this, is when you walk into the clinic, you can feel God. It is so different. A couple people have asked in the past, oh, is it weird? And I said, no, because God is there. God is present. And we see miracles in that clinic every single day. He is constantly working. What's interesting is the first patient that registered for the clinic actually had an abortion there in the prior years.
Really?
So for her to be there and come in was tough. She said she stood outside and kind of waited and hesitated whether to come in or not. And then she did. And we talked about it, and it's just so wonderful to see that transition and to see her now healing. And recently she baptized her baby at All Saints, which now is a different baby. But yeah.
Wow. I mean, because that takes the transformation to a whole different level. It's not just the clinic itself, but actually the people that come in. That's a fascinating story. We covered it. We got a story of the Washington Post, did everything, and I had never heard that. That's amazing. So the clinic is specifically for the uninsured poor. So does Catholic Charities have like a vetting process for kind of who would qualify for the clinic? How do they do that?
So we see the uninsured and underinsured. Gotcha. I'm sure you've heard with now insurances and all the different plans, and some people might be able to have insurance but not be able to afford their copays or not be able to afford their deductibles. We do see patients that are under 200% of federal poverty. So they do come into the clinic and they bring pay stubs or a letter from their employer, something to prove their income, to prove their residency in the western side of Prince William County, including Manassas City and Manassas Park, and as well as an ID. Something, to prove that they are really who they say they are.
Right.
So those are really our requirements. If they have their income taxes, we strongly encourage them to present those to us, and they get a longer membership to the clinic. So with income taxes, we give them a membership of a year, and then without them, they get a membership of 6 months.
I want to start asking you about some of the services and the things that you all do, because I think it's really interesting. But before I get into that, though, let me ask, there are other free medical clinics out there. There are different places that people can go. Why do you think people come to Mother Mercy Clinic? What's different about it?
So I think the biggest thing is the fact that we treat everyone with love and respect and dignity. We are a Catholic clinic, and therefore the environment says it as well. One of the biggest things we tell all our volunteers when we do the training is every person that walks in needs to be seen as a child of God. And we are there to serve their souls. And so we need to love them no matter what. We have a gamut of different people that walk into the clinic, but we all of them, sometimes people might come and lie to you, and you can see it right through them, and it doesn't matter. We are not going to get in an argument with them. We're going to treat them with love.
Do they not is that not something that they see in other clinics? I don't know anything about what the other clinics would be like, but.
So I think that, in other clinics, they are probably treated a little different. We have many of our clients from all over Northern Virginia that actually want to come to our clinic. And they're like, we know you're different. We've heard you're different. Our patients say that. Many of our patients, come and praise us all the time. Thank you for treating me with respect. Thank you for not, disrespecting me. I had one patient actually last week who said, I'm tired of going to all those other places and begging for help. When I come here, I'm treated so differently.
So it's like they're treated like a number, I would think, right?
Exactly.
Wow. So what are when you guys first launched, what were the basic services that you noticed coming up? Like, what is everybody kind of needing?
Education, I think.
In what way?
There's a lot of lack of healthcare education in our patients. A lot of them didn't, they just don't understand their health. Many of them can't afford or haven't been to a doctor in years. Many of them that have don't understand their disease process. Besides that, I do think a lot of our clients don't just have one problem, they have many. And so when they come in because they're maybe in an abusive relationship. Maybe they don't find, they don't have enough money to provide food for their families. So there's a lot of different things that lead them to now have these headaches or back pain or et cetera that are causing them, or diabetes, because all they're eating is food that's not healthy and able to control their
like
health.
Processed high carbohydrate type stuff.
Exactly.
So those are the types of, is diabetes the most prevalent disease that you see coming through, or is there something else?
It's diabetes, hypertension, and high cholesterol. Okay. Definitely. Okay. So I think they run together, the diabetes, high blood pressure, and cholesterol. And so a lot of our clients at least have one of those. The other thing that's very prevalent is a lot of muscle pain and aches because of the type of work that they do.
A lot of labor.
Exactly.
Yeah. So when someone comes in and they don't know about that the food they're eating is contributing to their health problems, is there a program set up, or there are resources? How does that education take place? Just on one-on-one setting or a classroom setting? What's that like?
So we actually have both. We have a classroom setting where we educate on prediabetes and diabetes. And we also have a dietitian who comes weekly and meets with our clients one-on-one and educates them on their diet, but not only with the client, but also the spouse. And in instances as well as the family, the children, so that the whole family can really learn how to eat and improve their health.
So since those early days, not that it's been that long at the time of this recording at least, what are some of the developments at the clinic? What have you seen as a great need and then had to respond to at the clinic?
One of the greatest needs we've had is food. There's nothing more heartbreaking than to hear a patient come up to you and say, well, I haven't eaten in days. And believe it or not, that's been the case on several occasions. So we have been working with Catholic Charities, St. Lucie Project, and we've also had a lot of community support where they've donated some food for us so that we're able to provide this to our patients. So we don't have a lot of room, but my office is kind of a food pantry. So
a food closet, I would think.
Exactly,
right? Yeah.
Exactly. So we always have emergency food for them.
That's great.
So if anybody comes in and says, "Hey, I don't have food for my kids," or et cetera, we have something to give them.
That's one thing I've noticed with Catholic Charities and talking with Art Bennett, the president and CEO, and just learning more about how it functions. It's really neat to see how when someone comes in and they have one need, if they are uninsured, they probably have other challenges going on as well, right? No one that has such small amount of money that they can't provide basic medical needs or nutritional needs, that's probably not the only problem. There's probably employment issues that are going. There might be family stress, so there's some counseling needed to repair some of the damage there, or there might have been issues in their upbringing, or there's just all these compounding challenges, housing, all that takes place. And when you go to a Catholic Charities site for help and they identify other needs, they then quickly connect you with other services and ministries within Catholic Charities that can provide for that. Do you all get referred people that way? And then do you also end up referring people out for the same reason? Because again, you can't provide for every need there. You've got limited storage for food, but that you can point them to St. Lucie's, you can point them to their parish food pantry or whatever it might be.
Yes, we work a lot with referrals. I don't think we could survive without it. So we refer a lot to family services, Catholic Charity Family Services. And most recently, we have one of their volunteers come to the clinic and provide mental health services at the clinic for our clients. We also work with pregnancy and adoption. We used to be an abortion clinic. Believe it or not, we still have people call and come in for abortions, even though it's been years since that abortion clinic has closed.
Wow.
We work with Gabriel Project and have referred people to them as well for the same reason.
Yeah, and so that's the St. Gabriel Project is, just for people who are listening, what is this, the Gabriel Project?
Gabriel Project is from the diocese, and they are able to help pregnant women with resources, in need and are able to talk to people that might be interested in an abortion, kind of talk them through what they need and how they may be helped.
Yeah, it's for women who feel like there isn't another option.
Exactly.
Yeah, they want another option, but don't believe that it's really there. And they maybe are pressured into doing this and they don't want to.
Exactly.
They reach out and they get the help that they need. Now, for a physician's assistant or a general practitioner, general internist, some of the needs you're talking about sound a little bit specialized, when it comes to like heart issues, or if it's cholesterol, or if there's like bone or muscle issues. It sounds like do you have other doctors that are able to come and help with some of those more specialized needs?
Oh, we have been so blessed. We never thought that we were going to get these many specialists coming to the clinic. We do. We have 2 cardiologists that volunteer.
Wow.
At the clinic. We have an orthopedic doctor that comes in, as I mentioned previously, the dietitian, as well as physical therapy. So these are the things that we actually use the most. We do refer out to also other providers. We have an allergist that volunteers services at his office, and he has an office in Fairfax and Alexandria, a dentist, ophthalmologist. So we have several different doctors that we're able to refer within the community podiatry. God has blessed us with a lot of resources.
Wow, because I know that wasn't there at the launch. There was a limited medical staff, and when we say staff, I mean how many doctors and nurses are now participating in some sort of either staff or maybe they're all volunteer. I don't know.
So we all of our medical providers, doctors, nurses, and interpreters are all volunteer.
Wow.
So we have total in registered volunteers. We have over 150 volunteers.
Wow, 150. So they're just
Yes.
on a rotation kind of weekly or monthly to come through?
Yes. So we have a sign-up genius, and we send it out, and they sign up for when they want to be there.
How has the growth of this impacted you personally? Just on like a personal, spiritual level, to see this many people come in and want to assist those who are uninsured or underinsured?
It has just been such a blessing to be part of this. I can't even begin to express the support from the community. God has just, every time there is a need, he just provides, So for me, it's just been, this is not my job. This is really my mission. This is where I feel like God is using me, and where he needs me at this time.
I heard that the clinic is working with the Virginia Department of Health on a project. What is that project?
So the Virginia Department of Health has provided the clinic with a scholarship with the SYNC project, which is teamwork leadership. And so with that, they gave us an option to work on different areas to focus. One was cancer, another one was diabetes, and another one was hypertension or high blood pressure. We decided to focus on diabetes just because we had such a high population of diabetics. One of the things after our first meeting, we decided that we were going to start screening all our patients for diabetes. It was a shocker to find out that many of the people that we were treating were actually diabetics, and we didn't even know it.
Wow.
So we've been able to implement the classes and the one-on-one with the dietitian and all these things to be able to help these diabetics improve their health, or pre-diabetics.
Yeah. Now, are there other classes? I'd heard there's even like natural family planning training, and there's exercise or something. I didn't get all the details.
Yeah. So we have exercise classes. Some of our patients have a gluten allergy, so we have gluten-free classes. We are in the process of starting natural family planning classes.
Oh, that's wonderful.
And we are also hoping to do parenting classes, as well as hypertension or high blood pressure classes.
Because going back to the point about some of the other free medical clinics, if they're government run, especially, contraception is going to be like infused into that as if that's like the only real option, which is somewhat degrading to their dignity and integrity, as if they are incapable of understanding and utilizing natural family planning. But that's also how the faith is woven in. We do everything differently. As the church, if it's adoption services, we're going to do it a certain way. If it's a medical clinic, it's going to be done in a Catholic way. It's apparent that you guys are really weaving that in tightly.
Definitely. we've had many people come into the clinic seeking contraceptives, and so we take that time to educate them on natural family planning. And so I think having those classes to back that up will be great.
Yeah, and it's a subtle evangelization. We're not forcing our faith on anyone, but again, we do things differently here. We hope you'll kind of participate in that and join in.
Exactly.
So when you look around the corner, what's the future for the medical clinic, do you think? What's next, if you could kind of imagine, look into your crystal ball?
Well, I don't know if you've heard, but Blessed Virgin Mary Foundation has purchased the building next door to us.
I did. I don't know what the next step is, so maybe you're going to break some news here.
Yes. So we have had several of our volunteers praying a lot for us to be able to obtain that building. And the reason is, as I mentioned before, although our clinic is wonderful, we don't have a lot of space. And because of the diagnoses that we're giving our clients, because of the complexity of the cases, it would be wonderful to have a chapel. So
nice.
We have been praying hard to be able to get a chapel in the clinic. And so the fact that they're buying this building will allow the clinic to now have a chapel, an area where we can take someone to talk to them, to pray with them. But not only that, for our volunteers as well, because trust me, some of the things that we come across can be extremely overwhelming.
Oh, I'm sure.
Not only that, we will have family services will have an office there to provide some mental health counseling. Pregnancy and adoption will also have a couple offices there so that they can provide services at the clinic. We'll use that space for classes. We had been using our waiting room up to this point, so it'll be great to have a special space dedicated just for classes there as well. And we don't know where God would lead us, but we're contemplating at this point possibly getting an ultrasound machine because of the number of women that are coming seeking an abortion. So if this is where God leads us, then he needs to provide us with the volunteers that will be able to provide those services at the clinic.
Wow, that's so beautiful. Like you said before about the integrated approach of they're going to have other needs, and to be able to provide for them more directly right there, I'm sure will increase the likelihood of someone following through and getting that help through Catholic Charities. And the idea of that chapel being there, again, we do things differently. When you're Catholic, you don't do it like everybody else does. Wonderful, beautiful. Is there anything I've missed, anything that you would want to share with folks that are listening?
What I would like to ask everyone is to please pray for the clinic. If you go to our website, ccda.net, there is a volunteer option for a prayer warrior. And you will get emails every week or every couple weeks just for intentions of the clinic. This clinic wouldn't be there if it wasn't for God and for the prayers of the whole community. Wonderful,
absolutely. And it is not inexpensive to run a medical clinic. It's free for the patients. It's not free to run. Please, if you're listening, please pray about whether or not you might be called to contribute to this financially, whether on an ongoing basis or on a kind of single basis. If you go to ccda.net, you can learn more about the clinic and the other services that Catholic Charities offers. But really, really pray about that. This is an essential ministry. It's something that's very dear to our bishop's heart, I know, and he was so joyful at the dedication. And we're really looking to expand the amount with which we can help those who are in need.
And one thing I would like to mention is we are extremely grateful for all our volunteers and all the community support that we have received from all these different organizations and individuals. Thank you so much, and may God bless you always.
So thank you for the effort you put into the clinic and the thoughtfulness with which you approach the patients. It is a great reflection on all the people of God, especially here in the diocese. So thank you so much.
Thank you, and thank you so much for having me.
Thank you for listening to Searching for More. If you enjoyed this podcast, please write a review on iTunes, Google Play, or Stitcher. Also, make sure you follow the Diocese and the Arlington Catholic Herald on Facebook, Twitter, and Instagram. And subscribe to our YouTube channels for regular videos that will inspire, educate, and inform you about the Catholic faith and our diocesan community.